You know, there's a common, treatable vitamin deficiency out there that can perfectly mimic a serious progressive neurological disease. It's a true medical mystery that often slips under the radar, and it can affect anyone, from babies to the elderly. Today, we're pulling back the curtain on this great imitator, vitamin B12 deficiency.
So, to really get a handle on this, we're going to follow a real-life medical case from beginning to end. We'll dive into what B12 actually does for our bodies, see what happens when it's not there, and learn how doctors solve this really tricky diagnostic puzzle. Then, of course, we'll look at the treatments and wrap it all up with what it means for you.
All right, let's kick things off with a story. It's all about a patient whose strange, persistent symptoms turned into a genuine medical mystery that had everyone stumped. I mean, just imagine for a second. You've got this painful, tingling sensation running through your arms and legs. It's there day after day, it's messing with your balance, and it just refuses to stop. Where would you even start looking for a cause?
Well, this was the exact reality for a 57-year-old woman whose story was actually featured in the New England Journal of Medicine. For 18 long months, she was dealing with this painful tingling, what doctors call paresthesias, and she could feel her sense of balance just getting worse and worse.
Her symptoms were basically textbook signs of something called a demyelinating disease. Okay, so think of your nerves like little electrical wires. They have a protective coating. Demyelination just means something was attacking that coating, making the signals between her brain and her body basically short-circuit.
Now here is the truly fascinating part. This really complex neurological problem can be traced all the way back to one single essential vitamin. So let's dig into the incredibly vital role of vitamin B12.
Vitamin B12, or cobalamin as it's sometimes called, is a real powerhouse nutrient. And what's interesting is, it isn't actually made by plants or animals, but by tiny microorganisms. We get it by eating animal products, and its two most important jobs are, 1, helping make healthy red blood cells, and 2, maintaining our entire nervous system. This really shows you the two-front war a B12 deficiency wages on your body. On one side, it can lead to a type of anemia where your red blood cells get all big and misshapen. And on the other, it goes after the nervous system, damaging that myelin sheath. That myelin is the insulation on the electrical wire. If it gets frayed, the nerve signals just can't get where they need to go.
So, if B12 is so unbelievably important, how does somebody become deficient in the first place? Well, the answer is a lot more complex than you might think. It's not always just about your diet.
Okay, have a look at this. The journey B12 takes is actually pretty complicated. It starts in your stomach, where it has to link up with this special protein called intrinsic factor. Then that whole package travels all the way down to the very end of the small intestine, the ileum, and that's where it finally gets absorbed into your blood. A breakdown at any point in that chain can cause a deficiency.
And that brings us to the groups who are most at risk. Now, the most common reason for a severe deficiency is something called pernicious anemia. It's an autoimmune issue where your body just mistakenly attacks the cells in the stomach that make that critical intrinsic factor protein we just mentioned. Other risks? Sure, diet, like long-term veganism without supplements, certain surgeries, and even just getting older. Up to 20% of older adults just have a tougher time absorbing B12 from their food. So with all these possible causes and these symptoms that mimic so many other conditions, how did doctors finally crack the case? This is where the detective work gets really interesting. And here is a massive plot twist. The standard blood test for B12, it can be shockingly unreliable. Get this, the source article says that test can be wrong up to half the time. And that is exactly what happened to our patient. Her first B12 test came back looking normal. So because that first test can be such a coin flip, experts recommend digging deeper. Doctors should also check for two other things in the blood: methylmalonic acid, or MMA, and homocysteine. You can think of these as little clues. When your body doesn't have enough B12 to do its job, the levels of MMA and homocysteine start to climb, basically screaming that there's a problem.
And for our patient, this was the smoking gun. Her MMA level was a staggering 3,600. Just for context, a normal level is under 400. This was the undeniable proof of a severe B12 deficiency that was completely missed by that first normal test.
Now, the best news in all of this is that once doctors have that definitive diagnosis, this condition is highly treatable. So what does that path to recovery actually look like?
So for a long time, the standard treatment was injections, right? They completely bypassed that broken absorption system in the gut. But now we know that really high-dose oral tablets also work incredibly well. See, even in people who can't absorb B12 the normal way, a tiny little bit, like 1 to 4%, can still sneak through. And if the dose is high enough, that's all you need.
And the research on this is crystal clear. The New England Journal of Medicine confirms it. Taking high-dose daily pills is just as effective as getting monthly shots for fixing both the blood issues and the neurological problems. And this is fantastic news because it gives patients a choice, a simple daily tablet or a monthly injection. So after following this whole medical journey, what are the most important things for you to remember? Let's break it all down.
Okay, here's the bottom line. First, remember that B12 deficiency is serious, but the damage is often reversible if you catch it in time. Second, and this is a big one, if you have symptoms that won't go away, don't let a single normal B12 test be the final answer. That test should include MMA, it's the most reliable clue. And finally, the treatment works. For people with absorption issues, it is a lifelong commitment, but with effective options like daily pills, it's totally manageable.
And what about our patient? Well, the prognosis for her is excellent. With the right B12 replacement therapy, her blood work can get back to normal in about 2 months, and those debilitating neurological symptoms can improve significantly within 6 months, a fantastic end to her 18-month ordeal. And this leaves us with one final, really important thought. We tend to brush off things like fatigue, brain fog, or a bit of tingling as just normal parts of getting older. But as we've just seen, they could be the first whispers of this great imitator. It's just a powerful reminder to listen to your body and to advocate for a deeper look when something just doesn't feel right.